Rachel, thanks. Following a COVID-19 alert here in Connecticut this afternoon, infections continuing to rise. Thanksgiving about a week away. Officials urging people to be smart to slow the spread of this virus. Looking at hospitalizations, they're also on the rise. According to the state's report from October 16th, there were 184 hospitalizations in the state. The report released yesterday, 1 month later, shows 757 patients currently in the hospital. Now, a doctor who's also a Democratic state senator here in Connecticut is warning state leaders, saying lives are needlessly being lost.
Fox 61's Matt Caron spoke with that doctor and takes a look at what Connecticut is doing to slow the spread and if experts think that's enough.
Well, we heard from Hartford Healthcare that while it wasn't the spike that we saw back in the spring, hospitalizations have more than tripled since October. After stepping out of the intensive care unit, a powerful video message from Democratic State Senator Saud Anwar.
Whoever is listening, if they're in the position of responsibility, they need to make a decision that we have to stop this transmission and use their authoritative power to be able to do it. People are going to die, and they do not have to die.
Senator Anwar is also a doctor who specializes in lung disease and critical care at Manchester Memorial Hospital. His oath, first, do no harm.
All the sacrifices of the last many months, we're losing them. Have a backbone and stand up.
But as the leader of the state, Governor Lamont is tasked with balancing the totality of the crisis. He said he has no interest in another lockdown.
It's not a matter of a lockdown. It's not a matter of a shutdown. It's a matter of a tailored response.
On the heels of a joint meeting with governors across the region, Lamont said hospitalizations are the key metric. 2 weeks ago, rolling back to phase 2.1, which reduced gathering limits, closed down entertainment venues, and forced restaurants to shut down in-person dining by 9:30 p.m. But the curve kept getting steeper.
The number of patients that are coming in are many more than what we had expected.
Dr. Ajay Kumar, the chief clinical officer for Hartford Healthcare, offered a more diplomatic answer.
You can always think about that. Can you tighten it a bit more? Can we reduce those a bit more? And I think some of those conversations, I believe, are happening right now. We might see that, but at this time, I can't fault for several weeks what our administration has been doing. I think they've been thoughtful.
And just to end on some positive news, Hartford Healthcare did tell me that they've made some great progress treating patients. The rate of death has dropped, and so has the number of patients that they've had to put on ventilators. Reporting outside the state capitol in Hartford, Matt Caron, Fox 61 News.
Thank you. And just moments ago during Matt's report, the latest COVID-19 update was just released by the State Department of Public Health. Let's dive into that. Hospitalizations are now nearing 800 total patients, with 20 more being treated since Monday. The positivity rate of new tests and cases is up over 5%. Again today, around 5.2%. Sadly here, and this is a number we hate to see, a total of 12 more people in our state have died with complications related to COVID-19. Vermont